Moving on, please join me with Dr. Sandeep Seth to share his insights on the vital topic of prevention of heart diseases. Dr. Seth is a professor in the Department of Cardiology at AIIMS New Delhi and is a leading expert in heart failure, interventional cardiology, and stem cell therapy. He has been instrumental in developing and strengthening the heart transplant program at AIIMS. He has also participated in policy discussions and contributed to national guidelines on heart transplantation and organ donation. We welcome you, sir.
Thank you. I would at the outset like to thank Dr. Anil and the entire team of NOTTO for giving me this chance to talk about a topic which is very dear to my heart, and especially in the month which we celebrate as Organ Transplantation Month. And this month was actually chosen because one of the reasons was that on 3rd August 1994, AIIMS did the first successful heart transplant done by Dr. Venugopal. And in honor of that, we initially declared 3rd August as the Heart Transplant Day. And later on, the government decided that rather than having a day, we should have an entire month of celebrating organ transplantation. So, coming to the topic, I'm going to talk about not about the disease once it's occurred, but rather than prevention of heart disease. Let's just start my slides first. I hope the slides are visible now.
Yes, sir, they are visible.
Okay. So we'll start the topic, and I was given to understand most of the audience would be health professionals. So this will be uh, based basically at the health professionals only. Cardiovascular disease is a major burden in not only in India but all around the world also, and almost 1/3 of all the global deaths occur because of cardiovascular disease. And where maybe a few decades ago infections, neonatal mortality were the major causes of global death, now gradually the rates of cardiovascular disease, which would include ischemic heart disease and stroke, those numbers are going up and up. As we go into more developed countries, including India, though the rates of acquired diseases like ischemic heart disease, stroke are going up, whereas the causes like infection and neonatal mortality are going down. So, as per WHO data, almost 17.9 million deaths occur annually because of cardiovascular disease, and majority of these are due to heart attacks and strokes. And again, a number of them can actually be prevented by modifying the modifiable risk factors. So, this is where India stands. India is responsible for 20% of the global cardiovascular deaths, and the mortality rate in India is relatively higher as compared to the global standard, with the age standardized cardiovascular mortality rates of 272 per lakh population versus a rate of 235 in the rest of the world. Most cardiovascular diseases, as like other diseases, occurs early in India. So it's an early onset, almost 10 to 15 years earlier. So our heart attacks, hypertension, all these diseases will occur almost 10 years early as compared to the Western counterparts. The causes for these cardiovascular disease are well fairly obvious to some extent. Dr. Shukla also talked about this. So urbanization, sedentary lifestyle, poor diet, poor awareness. And this is in more detail. So there's something which we can't really change. You can't change the fact that you're aging. As you age, the risk of cardiovascular disease goes up. Males are more prone towards cardiovascular diseases. Ladies after menopause also get the same risk. Family history of cardiovascular disease is very, very important. So if you had a relative who's had cardiovascular disease with the early onset, it's not that if you have the cardiovascular disease at the age of 80, that would not count as family history. But supposing it occurs at a younger age, maybe at 40, 45, 50, that amounts to a positive and strong family history. Race, ethnicity, so Indians are more prone. There are some genetic diseases which lead to hyperlipidemia, so those can also lead to more cardiovascular disease. These we can't really control, but what we can control is our nutrition. Both undernutrition and obesity are both risk factors for cardiovascular disease. Then smoking, obviously, then hypertension, hyperlipidemia, easy to diagnose and easy to control. Diabetes, again, should be diagnosed. I'll come into this later, and should be controlled. Physical inactivity, with our development, with our busy lives, starting work from 8 a.m. in the morning till 12 o'clock at night, we really don't find the time to exercise. Alcohol consumption, I think I'll be talking much less than what Dr. Shukla had already talked about. So, what is the prevention? If you switch on the radio anytime, you are hearing again and again and again the Honorable Prime Minister talking about a healthier you. He's emphasizing a lot of our fight against obesity and emphasizing that we should be more active and should be using less oil. This was there in one of the monkey baths which he talks about every Sunday. The types of prevention starts from primordial prevention to primary to secondary prevention. Just to explain the differences, primordial prevention is when you're intervening in the community. You're looking at potential risk factors. So you are looking at sedentary lifestyle, obesity, lack of sleep, diet, smoking, hypertension, dyslipidemia, kidney disease, that then stress. So all these factors you're trying to reduce in the community, encouraging children to have healthy food, encouraging everyone to exercise lot more, look at and diagnose the hypertension, control it, diagnose diabetes and control it. So that is primordial. That means no disease has occurred as yet, but you're trying to improve the general health and well-being of the population. Then comes primary prevention. Primary prevention basically means that some event has occurred and is likely to occur. So your risk factors are there. Myocardial infarction, congestive heart failure, these will be the manifestations. So your primary prevention worker means basically you have to look for the risk factors in a individual. Primordial was in the community, primary comes in an individual. For instance, if you are sitting in your clinic and a patient comes to you, he's about 50-year old, he's smoking, he's diabetic, and he's very obese, has a family history. 4 risk factors, not modifiable, he's male, Indian, 6 risk factors. So automatically, without using any risk calculators, you know that he is very likely to develop a cardiovascular disease in the future, and he will benefit from some preventive measures, which in this case would be a certain amount of statins for cholesterol control. Irrespective of what his cholesterol is, it is recommended you would give him some amount of statins. You may or may not consider aspirin, but as of now, the recommendation is against aspirin. Secondary prevention basically means that the disease has occurred. So, for instance, you had a patient who's had a myocardial infarction, then the preventive treatment and strategies go much higher. You're very aggressive to prevent another event. So, let's look at the risk factors. Hypertension. Hypertension is a major problem in India, and especially because it's a silent disease. In one of the recent surveys which was done nationwide, 28.5% of the population was found to be hypertensive in an adult population. Out of this, only 27.9, that means almost one third, were actually aware that they were hypertensive. And of these, of the patients who were hypertensive totally, only 14.5% were on treatment and only 12.6% were actually under control. That means in this population of 28.5% of our general population, those who were hypertensive, only 12.6% were actually under control. And what is the control? So normally, if you understand blood pressure, hypertension is above 140/90. That's your first target, that you bring the blood pressure down to less than 140/90. But if there is a high risk factor, patient is diabetic, is obese, is a smoker, has a family history, then your targets go somewhat down. So you bring it down to 130/80. But this is something which you can do fairly well, and it's easy to control. So drug therapy, lifestyle changes, modifying your salt intake, reducing your salt intake, increasing your physical activities, standard management of hypertension. Switching on to diabetes, again a major cause of cardiovascular disease. Here also, if you see, the entire body is affected by diabetes, and again it is a disease which is silent. Manifestations usually don't occur unless you are doing regular checkups. You will often miss diabetes until it has already caused some organ damage. So it will affect the eyes, called retinal changes. It will affect the heart. It can cause coronary artery disease, can cause a myocardial infarction. It will obviously affect the kidneys, also cause renal failure, which starts with the microalbuminuria, which can be picked up and then preventive steps taken, or ultimately it will manifest as kidney disease. And of course, peripheral vascular disease. So these are 4 major manifestations of these. And it is better to pick up diabetes before these manifestations occur. Basically, before end organ diseases occur, you want to pick up diabetes. And once you picked up diabetes, you want to use the maximum possible therapy and lifestyle changes in diet to bring the HbA1c at least to less than 7%.
आपण ते ऑर्गन
Lipid,
डोनेशनचं केलं होतं आठवतं का तुला?
lipid management, once we talk about lipid management, whenever we
अपन
talk
दोनों
of
सुन सकते हैं,
primary
सब
prevention,
लोग
we
मुझे
are
बताएंगे
trying
कि
to basically look
अच्छा
at
पता
the
चले
risk
जाने
an
इंटरनेट
individual
का
has.
मैसेज ना हमें लाना होता
We are trying to calculate the risk a patient has for cardiovascular disease. So it's very simple that you can use one of the risk calculators. You can use the for India the best calculator. One of the best calculators is Curious 3 because in that you can actually choose whether the patient is from India or otherwise. And based on that, based on the risk which comes, you can take a decision on whether you want to start statins in these patients. So this is for primary prevention. That means the disease has not occurred, but you've got risks. So the risk includes patients who are smokers, have diabetes, or they have a relative who's had a heart attack or angina, or there's kidney disease, blood pressure is not controlled. Even things like migraine, rheumatoid arthritis, SLE, and mental disease have also come into this risk calculator. Based on this, you take a decision on whether the patient has risk of heart disease in the future. And this is what you do with the reports. You look at the lipid profile. You classify the patients as low, moderate, high risk, and very high risk. So very high risk are patients, for instance, who have established cardiovascular disease or have diabetes with end organ damage. So here you're most aggressive. Here you want the cholesterol level. Basically, LDL cholesterol is the target. So you want LDL cholesterol less than 55. And sometimes if there's recurrent cardiovascular disease, you want it even less than 40. So practically no LDL cholesterol in the body. High risk will be patients who have markedly elevated single risk factors. For instance, uncontrolled blood pressure or LDL is more than 190. So any one risk factor or prolonged diabetes or any other factors. So in these, the target again is fairly strict. That means you want a LDL of less than 70. If there's moderate risk, for instance, a patient who just has diabetes or on treatment, you would want to consider more often that you should put these patients on statins and bring the LDL down to less than 100. If the risk is not very high, for the rest of the population, if there is some risk factor of disease, then even otherwise, the current guidelines suggest that LDL cholesterol less than 116 is the ideal for a normal person also. So it initially these targets were much higher. Initially, we used to think that less than 130 is good for a normal population, but now the targets are getting more and more stricter. Supposing you have developed coronary artery disease in any form, angina or a heart attack, then the prevention level becomes much more aggressive, and we would assess the LDL levels. Based on that, our targets are less than 55 for most patients and less than 45 for patients who have multiple and recurrent disease. And you would start with statins, but you will often escalate to some of the other oral drugs like bempedoic acid or estimate. And if necessary, you can use injectable drugs like PCSK9 inhibitors and inclisiran. So all these are now available in India. Costs are gradually coming down, and it is important to understand what levels of LDL are we talking about and what drugs are available. Switching on to smoking. So again, there is no safe level of smoking. You can't say I smoke once a week or one cigarette a day. Any smoking is bad. In fact, we had done a study in the cath lab where we were doing angios, and whenever we had a patient who was a habitual tobacco chewer, we would ask the patient to chew tobacco, and we would find that the coronary arteries started showing spasm and reduced caliber while the patient was chewing tobacco. So it shows very effectively that it's not just smoking, even tobacco, even chewing tobacco. Once you put nicotine in the body, it is harmful. So the 5 A's of smoking cessation: understand the level of smoking in the patient. Ask, what do you smoke? How much do you smoke? How long have you smoked? Then you give an advice. First, you can try gentle advice, explain the harmful effects of smoking, for instance, cardiovascular disease, stroke, then also explain the more dangerous effects like cancer. You can also frighten the patient by showing pictures, as often happens on the television. Then you try and assess by talking to the patient whether the patient is actually going to listen to you. Then you can help the patient by talking to the relatives also. Maybe you can put him in a detoxification program. And it's more important that once you label a person as a smoker, follow him up. Call him back for a checkup after a week or two, and then see has he taken any steps towards stopping smoking. But it's not just giving advice which is important. You have to follow through and ensure that the advice is followed. Diet, of course, most of this was actually covered by Dr. Shukla. I'll just repeat it. Basically, we prefer for cardiovascular disease a low carbohydrate, low fat, high protein diet with high fiber. So you avoid the use of trans fatty acids, red meat. Again, emphasis is that try and avoid processed food, whether it's food which comes out of a tin or a plastic box. So your chips and all these things go out. Encourage whole grains, fruits and vegetables. Fruits, vegetables, nuts, so almonds, walnuts, even peanuts, fish. These are all good for the heart. Salt intake should be reasonable. You should not add too much salt to the food. You should avoid full fat dairy products. You should avoid red meat. And again, as I emphasized, processed and market products like sweets, burgers, especially the McDonald's burgers with extra cheese, pizza with extra cheese, wafers. So all these are avoidable. You can, if necessary, if you feel like it, take it once a week. Maybe just take a slice of a pizza or just take half a burger if you really like it. But otherwise, as a regular habit, taking it daily is totally avoidable. Exercise again is something which cannot be overemphasized. With a busy lives, we just forget that we have to exercise. And it doesn't mean that you have to join a gym or you have to follow a trainer with you. 150 minutes of exercise per week basically amounts to 30 minutes of exercise 5 times a week. So if you have your step counter on your phone or you take a smartwatch, basically even if you take a walk for about half an hour, 45 minutes, you can get easily 1000 or 2000 steps in. And plus, if you during your work day park your car a bit away, walk 1 or 2 flights of stairs, and generally try to be on your feet more, you can achieve at least 4,000, 5,000 steps easily. And you maintain an active lifestyle. And over the weekends, maybe if necessary, you can increase that activity, maybe do some kind of stretching exercise. Stretching exercise is a very gentle amount of strengthening exercise using simple, very light weights or exercise band is usually very good. Stress, of course, in today's world with the kind of lives you're leading, stress is a major risk factor for heart disease. It increases the blood pressure, causes vasospasm, causes coronary spasm. So you have to try to help your patients find ways to relieve stress. For instance, they should walk regularly, exercise regularly, maintain a healthy lifestyle, have social connections with friends. Once you go out with friends, obviously your stress levels come down. And maybe you can take things like yoga classes. If nothing else works, connect the patient to a therapist who can at least talk to the patient and try to reduce the stress levels. So, just to summarize, basically you have primary prevention. Basically, you're trying to protect tomorrow by following good practices today, which will improve simple things like exercise, diabetes diagnosis and control, diet management, avoiding smoking, looking at your cholesterol, looking at your blood pressure, and assessing the risk. Basically, it's a question of numbers. You take out all the numbers that you have, blood pressure, cholesterol, diabetes, all these numbers, and control, keep an eye on the numbers. Secondary prevention, once disease has occurred, you have to ensure that your patients and all of you take your medication on time. You will, after some medicines, you will obviously feel normal and fit. That does not mean that you stop your medicine. Many of our patients actually stop their medicines and then they have a second heart attack. Regular follow up with the doctor is essential. Once you're very stable, then you can follow up with the doctor, but at least once a year. That is the bare minimum. Initially, when you're sick, you obviously need much more frequent follow up. And rehab programs are necessary if you had some cardiac damage or even otherwise. Some gentle rehab programs are obviously good for your mental stress also. Risk factors cannot be overemphasized that these risk factors have to be controlled. For us in the cardiology OPD, we repeatedly found that it's very difficult to make a patient stop smoking. Cholesterol is easy to control. We just put them on high dose statins. Blood pressure is easy to control. What is often difficult to control is diabetes, because some of patients don't realize the importance of controlling diabetes very well. And this needs fine tuning of the diabetes control, but this has to be done. And the patients should have family support. They should have other people who know about the disease. They should also talk to other people who have the disease and get support for themselves. So in conclusion, basically, if you want to prevent cardiovascular disease, you have to act early, you have to screen the patients, you have to counsel the patients once you diagnose the patient, and you treat them properly, aggressively, and follow them up regularly to ensure that their management is done properly. Thank you very much. I'm open for any questions if there are any questions.
Thank you so much, sir. Thank you for reinforcing that cardiovascular health isn't just a personal responsibility, but a public health priority as well. Your message resonates deeply with every listener today. We thank you for your insight.
Thank you.
Thank you, sir. Thank you very much.
Thank you, sir. Thank you.